Human rights advocates and healthcare officials are demanding that the Trump administration take immediate steps to safeguard the lives of migrant children in detention after 5 minors in 5 months have died while in the custody of the U.S. Border Patrol.
The most recent death was reported on Monday, and there is a disturbing link of infection in all of the cases. Joining us with a closer look is registered nurse Alice Benjamin. She's also a clinical nurse specialist. Good morning. Good to see you.
Good morning.
We mentioned just a moment ago the link of infection in all of these cases. What is the overall medical condition that played a major role in these deaths?
So the deaths from these children all seem to stem from complications of respiratory illnesses. Many of these kids presented with cold and flu-like symptoms. And what we do know about cold and flus is that they can quickly turn into bacterial infections. And what happens is if that's localized, we can get it treated, that's wonderful. But when these infections start to become raging, they can spread to other parts of the body and actually enter into our bloodstream, which then can cause the infections to become systemic, leading to what we call severe sepsis, which then can lead to multi-organ system failure, and then the heart begins to shut down, the lungs shut down.
How quickly does something like that happen?
Oh, this can happen very rapidly.
Really?
We see this in the emergency room. When someone comes in with an infection, there are certain signs and symptoms that we're looking for, and that's why vital signs are very important. We can detect these subtle changes and quickly jump into action and treat someone as if they are in sepsis.
You know, we hear about them sort of as statistics often, and it's easy to forget these are individual human beings who are dying, children who are dying, and you've looked into some of the specific names and what happened with each one.
Yes, so with Carlos Gregorio Hernandez Vasquez, 16-year-old, he was in custody for 7 days, and he died of the flu. Now, he was in custody for 7 days, didn't report not feeling well till the 6th day. And actually, he was seen by a practitioner. They said he had influenza A, and they gave him Tamiflu. But by this time, he's already had the flu for a couple days because it takes 1 to 4 days before we actually start to see symptoms. And it's not Tamiflu that cures your flu. You actually need rest. You need plenty of fluids. You may need antibiotics. You might need other medications. So Tamiflu alone is not enough for this gentleman. And ultimately, it spread, and he ultimately died, yes. Yeah. Other child. So there was an unnamed boy, 2 years old, who died of pneumonia. Now, it's very important for people to know that babies don't just spring up with pneumonia. Pneumonia is a secondary complication from a cold and flu virus. Now, the baby was in custody for about 3 days before mom said that the baby was sick. And then they were rushed to the hospital. That baby spent over 4 weeks in the hospital. And again, they have pneumonia. So had a high fever, difficulty breathing. This is a baby that I'm sure went to the intensive care unit, needed massive fluids, antibiotics, and a lot of other treatments. Also, Juan Delante Gutierrez, 16 years old, died of Pott's puppy tumor. So that's not a cancer. It's actually a medical emergency. It results in infectious sinusitis, which causes an infection in the frontal part of the skull, which leads to bone infection. So the way to cure this is to actually go and surgically drain the abscess, remove the infectious bone, and weeks and weeks of antibiotic therapy. And, you know, near the brain, we have to be very careful. A lot of pressure, infection, it can be very deadly. In his case, that proved to be the point. And then also, Jacqueline Cal McKean, 7-year-old, died of streptococcal sepsis, bacterial infection. This young lady was only in custody for 2 days. Many health officials read her profile. This is a young lady who had to have presented with severe symptoms. When she finally got medical attention, fever was 105.7 degrees. Oh my God. She had seizures, vomiting, difficulty breathing. She went to cardiac arrest twice before being air flighted to a children's hospital. And she was confirmed her autopsy with having a bacterial infection in her lungs. And then Felipe Gomez Alonso, 8-year-old boy, died of influenza B. We know that influenza is a very contagious bacteria, and he went to the emergency room, got care, but they dismissed it with it being a cold. They gave him an antibiotic, which you don't treat viral infections with antibiotics, sent him home. He returned back later, had a fever of 103 degrees, was vomiting, nauseous, lethargic, unconscious, and later was pronounced just moments before Christmas.
Why do these deaths fall into a medical category called failure to rescue? What does that mean?
Failure to rescue is when we as health professionals fail to notice subtle signs and symptoms of changes and deterioration in someone. And because of our failure to notice these things and put these puzzle pieces together, we fail to provide action and getting people the treatment that they need. And sepsis, someone can die from sepsis very quickly in a matter of a few hours. So you need to notice the subtle signs and changes. So it's very important that there's monitoring to detect these things in these children.
You know, some people have said, look, the parents are bringing these kids on these long journeys that they're not equipped to be on, and they blame the parents. Other people blame the Border Patrol folks or the people who are incarcerating these kids. Is there any way to know if these deaths could have been prevented in some way?
I think that children are otherwise resilient, and there are a lot of measures that both parents as well as Border Patrol custody could have done. And these are children. It's our duties. Whether it's my child or not, I'm going to take care of this person as if it is my child. They're going through strenuous conditions, lack of food, lack of water, they're weathering the outdoor temperatures. There's no soap and water, infection control. You're exposed to other people who are sick and ill. And then, you know, it's a very stressful journey.
Yeah.
Right? So these are things, there's some preventative measures that could have been done so kids aren't exposed to this or placed at risk. But once, I mean, I used to be the charges of a detention center. I did an assessment of every child that came in. It's important as adults that we ask kids, you know, how are they feeling, noticing subtle changes, and even to have just, you know, taking your blood pressure, temperature, heart rate, monitoring oxygen. These respiratory illnesses prevent someone's ability to breathe. Sometimes you're so weak and lethargic from that happening, you can't even advocate for yourself. So there are a lot of things. I'm really going to encourage the Border Patrol to really put some systems in place and staffing in proportion to the amount of people that are there. You can't just have one nurse and treat, you know, thousands. You're going to need health-trained professionals. You're going to need medical equipment, and we're going to need to act, rather be proactive and save a life than not reactive enough and another child dies. Unacceptable.
Thanks for being here this morning, Alice Benjamin, an emergency room RN and clinical nurse specialist. You can follow her on social media. Also check out her website, asknursealice.com. Still to come this morning, instant regret at a